Good evening and welcome to the Weekend Wellness Hour. We had a little bit of a schedule change this week and we are having our guest today, Dr. Jenna Blasi, on in the evening because, well, I started out planning to volunteer, then got a little under the weather. So luckily I have my voice. It had disappeared yesterday, but it's back today, and very happy to have Dr. Jenna Blasi on with us today. She's a naturopathic physician here in Sedona. So she helps a lot of people in this small remote town in Arizona in the Red Rock country. Beautiful place. That's a healing destination of the world. So I'm very excited to bring in one of the top physicians here who helps people heal, and excited to bring about a topic that's a little bit different in the healing world, at least what I've been exposed to. And so Dr. Blasi is going to talk to us today about core synchronism. So first, I just want to welcome you, Dr. Blasi, for joining us today.
Thank you so much for having me. Appreciate
it. Thank you. So what I want to share first is a little bit about your background. So how did you end up here, Sedona, doing, naturopathic medicine?
Gosh, it's kind of one of those Sedona stories where I landed in Sedona. I feel like it pulled me here. I had gone to massage and natural therapeutic school, and my husband and I, then boyfriend, were traveling around the Four Corners area because we had met in Colorado, looking for a place to live. And he said, "What about Sedona?" And I said, "No," because everybody and their sister was a massage therapist, and I had just graduated from massage school. And then we drove here, through here, and ended up driving right to this house that we rented. And the next thing I knew, we were renting a house and I was starting my business.
Oh, that's amazing. So
naturopathic school.
Really? And then at what point did you go to naturopathic school?
So that was a few years later. I had almost gone to naturopathic school years prior. And then I had this thought of, how can I go through naturopathic school and stay well? How can I go through 4 years of intense medical school and all of this money? And what if the day I graduate after 4+ years, I get hit by a bus? What will I have done with my life? And so then I thought that doesn't sound like a good idea. And I decided if I used the little bit of money I still had saved and traveled around the world and studied with different healers from all over, that I'd be much more eclectic at the end of that 4 years and not be in debt. And so I decided to do that. And then so massage school was a part of that. And then we ended up here. And I started a practice. I'd gone to cooking school. So I was teaching cooking classes. I trained in Core Synchronism and I was doing that. And people were treating me like I was their doctor. So they were coming in, they were calling me doc. Oh. They were on medications. I didn't know what they did. They had diseases I didn't understand. And it kind of came around full circle. And I had some friends visiting from naturopathic school. And after they left, suddenly I looked at my husband. I said, "I think I'm supposed to go back to school. Are you all right with that?" And so I did.
That's amazing. And I know you also have a background in fitness as well. So at what point did that come into the fold?
That came into the fold in high school, actually.
Okay.
I was working out all the time. And then one time the instructor was having some bowel issues and she had to be running from the room. And so she said, in my world, there's no TMI, just so your listeners know that.
That's okay. They know that.
And so she said, "Can you cover me if I need to go to the bathroom?" And then when she left and I taught, I loved it. And so I started teaching then. And then when I was in college, I taught at my dormitory, and then I took a number of years off. And when I went to naturopathic school, I realized it was a great way for me to make money and be forced to stay fit during a really intensive program. So I went back while I was my first semester in school, did all my training to get certified as a fitness instructor, and started teaching again.
Well, that's wonderful. So, I mean, you're basically hitting health and wellness from every aspect. You have nutrition, you have exercise, fitness, you have the physician medical world using plants and other, medicine to help us feel better. So you really have a great wealth of knowledge. I mean, you've been in this now for over 20 years, right?
Yeah, I really felt like that was an asset when I started naturopathic school, that I had already been studying. I had gone to herbal school and natural cooking school and studied all these modalities. And my massage school was a whole natural therapeutic school. So it was very broad in the things that were covered. And I had gone to homeopathic school. By the time I got to naturopathic school, I was ready. I knew I had the tools I needed actually this time around to know that I could stay healthy during those 4 years and I could take care of myself. But I got into it initially in theater. So when I was in college, I was majoring in theater and biology and French. And my director said, you can't get sick. None of you can get sick. And he handed us a sheet of paper and he said, if you get sick, this is what you do. And it was like, take vitamin C and don't eat dairy and don't eat sugar. And I thought, well, what effect if this will help me when I'm sick, what effect might this have if I implement some of these changes while I'm still healthy? And that was the beginning of my journey into realizing how much power we actually have over our well-being and how good we can feel.
Yeah, that's incredible. And it's great that you pursued it in so many different avenues, because when people come to see you now, you can address so many more concerns and give a holistic approach because you have all these tools in your belt. So one specific that really drawed me, to bringing this up is the core synchronism. And I'd like to dive into that. Like, how did you get into it and what is it?
So core synchronism is a blending of therapies that people may or may not have heard of, which is cranial osteopathy, like osteopaths do, and polarity therapy, which is a therapy by Randolph Stone. And it's a blending of those similar to cranial sacral therapy. So the originator of core synchronism is Robert Stevens, and he took the studies and developed core synchronism. And Upledger, who people who are fans of cranial sacral have heard of, he took that information and went a different direction. They're similar in that they're working with the cerebral spinal fluid in the body. I like the analogy of a garden hose. So the cerebral spinal fluid in our body flows through all areas. And like when you're watering a garden, you want that water to reach all corners of the garden. And if it gets tight or restrained or restricted in any area, those areas then would die in a garden. In case of our body, we'd have pain or inflammation, or even in the brain, I see repetitive thought patterns because the brain is actually stuck and it's not flowing as it should be. I got into it in massage school. So when I loved massage, loved it. And then as soon as I got introduced to energetic therapy, which I consider this to be, it was like, I was like, oh no, this is really for me. And what was happening was I was doing certain holds on people, and I was seeing things and feeling things that were not part of what we were being taught. And so I'd call my teacher over and say, like, this is what I'm feeling. And he's like, oh, that's core synchronism stuff. So
That's amazing.
And as a recipient of it, it is the most relaxing therapy for me that I've ever received. I love getting a good massage. There's a place for all of it. But when I receive core synchronism, there's a level of depth that I just drift off to that's really restorative.
That's neat. So can you tell us a little bit what exactly is happening to the body? I mean, you mentioned the cerebral spinal fluid. And so we know that's, goes along our spine, brain. So we have this fluid. So what exactly, can you go into more detail what it is?
So the cerebral spinal fluid, we know it physiologically as just sort of, it originates in the ventricles of the brain and travels down the spine. But the communication of the cerebral spinal fluid goes to all corners of the body. And so all of the muscles and bones and organs, brain, and for those that have an understanding of like the etheric body and the emotional body, everything should move in a certain synchronistic pattern. So for example, years ago when I was in cooking school, the daughter of the woman running the school had shin splints, and she was an intense karate trainer. And so she had these terrible shin splints. I think she was 18 years old. And one day we had a 15-minute break and she was telling me about the pain she was in. And I said, well, let me just check your leg. So for example, the two bones of the leg are supposed to move in a certain synchronistic pattern. And they were going the opposite way and they were kind of hitting each other, which would cause pain. So in the very little time I did, it's very gentle, like cranial sacral. I've learned to listen with my hands, and I could feel that they were out of sync. And then I gently remind the body and hold it until they come back into a synchronistic motion. She saw me the next day. She said, I woke up today for the first day without pain. It's the first time in months I haven't had pain. Then she continued to intensively do her karate competitions. And when I saw her 3 months later, the pain hadn't come back.
That's wonderful. That's amazing.
It's not always that one 50-minute session would last that long, but she was really resilient and really took to it quickly.
That's great. So when people come to see you, they have some body aches or pains or whatever. Do you do a full body evaluation? Is it a hands-on evaluation where you're finding the restrictions? Or like, let's say I have knee pain. I come to see you. Are you assessing the areas around my knee? What does that whole process look like?
All of that. So I don't do a pre-treatment assessment. Like, I'm
Mhm.
not looking at the body and assessing. I really love when people just want to get on the table. Some people like to tell me the background of what's going on, and then that's great. Or they'll say, make sure you look at this elbow or look at this shoulder. And
Mhm.
that's fine. Other people, it's like they want to test me. They're like, I'm not going to tell you anything, and I want to see what you find. And that is totally cool with me too, because
Yeah.
then I find it, and then they're like, oh, okay, I get this now. Like, you're seeing things, I don't know why, or feeling them. So I get people on the table with or without some information. But even when I have information, because sometimes it's people I've treated for a while in my naturopathic practice before they get a session, I like to clear my brain. I really want to work with thinking fingers, so that when I put my hands on people, I'm not working from an agenda. I'm really listening
Mhm.
to what their body's trying to tell me. So if you came in with knee pain, for example,
Mhm.
I'm definitely going to address your knee, but I'm also going to look at the basic relationships in the whole body. And I like to start at the feet and work
Mhm.
my way up, because so many times, like, if I put my hands on someone's head and there's an imbalance, it might be coming from the feet. So
Yeah.
if I work from the ground up, then by the time I get to their head, I know that's really from there and not from the hips or from the feet.
Mhm.
And then the knee, when there's knee pain, it's often out of sync with the foot or with the ankle or with the
Yeah.
shin. And so I do the whole leg, I do both
Okay.
legs together. And the other thing is, in working with just listening to the body, I might get the message to do the right shoulder with the left knee. And I
Mhm.
won't necessarily intellectually come up with that, but the body will bring me to that area, and I'll go, okay, there's some connection here. And then the person might be aware of it. Like, oh yeah, ever since I fell on that shoulder, I've had problems with that knee. Or they might not be, but it's being guided by the body and where it's taking me.
That's incredible. And it's amazing how your hands can feel so much. And you have the training to do that. So when you're palpating and putting your hands on someone, is it very light pressure? Is it just you're touching, your hands resting? Or is it harder pressure?
Very light pressure, very light
Okay.
pressure. First time I worked on my mom, she was like, what are you doing? Like, I don't feel anything. And then I was like, Mom, I shouldn't disclose pull my mom into this, but, I said, you have a deviated septum. She was like, how do you know that? And so then she stopped asking me, what I was doing. But so it's very light pressure. I have had a couple of patients over the years that actually can't handle any pressure, or maybe their
Mhm.
scalp is incredibly sensitive. And I
Yeah.
actually have to be even lighter, or sometimes work off the body. And in doing that, I've actually took me years of doing, I've been doing this work since, I guess, 1998 or 99. I can now do distance sessions on people,
Oh,
because,
neat.
if I'm working on someone's head, I'm actually tuning into their organ. And then I thought, well, if I can do that, how much further? And the first time I did a distance session, I was amazed, as was my patient, at how much actually it was like a direct line. And all of this, sometimes I'm a little bit of a perfectionist, so I'll feel all of this minutia sometimes in my hands. And I remember one time in my training, I'd call my teacher over and say, well, I think this is in sync, but I'm feeling this and this. And he was like, Jenna, like, it's in, like, you've got it. And so distance kind of takes away some of that noise, and
Got it.
allows me to even, let go of that piece a little bit, but it
So when you say distance, how far away is the person?
doesn't matter.
So they could be across the country.
I mean, if I can legally treat them,
Right,
that's
right, right.
the key thing. Yeah. So, I have patients, for example, I had a patient recently who contacted me a little, here comes that, TMI piece, a little bit
Mhm.
desperately, because she was traveling. Now, she was only a few hundred miles away, but
Yeah.
her bowels had stopped up. But we had done she's a regular at Sedona. We had done our first distance treatment in Colorado, when she was in Colorado a few months ago.
Mhm.
And she was like, I haven't gone to the bathroom in days. Like, I feel terrible.
Oh.
Help me. And normally I don't do early morning house calls, but it was like, I happened to be up early enough. And I was like, okay,
Yeah.
I have time to do a treatment. It was like 7 o'clock in the morning, and I did it. And then I went to teach my fitness class at 9 or something. And as I was hooking up my phone to get my music, her text came through and said, I went to the bathroom right after you were done. I feel so great.
That's
So
amazing. That's a great feeling too. I don't
I
think anyone would disagree.
exactly.
That's awesome. So what are all the type of conditions that you can help people with?
That's the interesting thing about this work, is it really can treat just, I mean, anything. And the reason is, it's similar in that saying, like, we can all benefit from meditation. That doesn't
Mhm.
mean all of us will enjoy meditation. So people that, like,
Right.
really want deep tissue work, maybe they don't want to lay there and feel like they don't really feel that much. Although even some of those people get won over, because they, despite themselves, end up being quite relaxed. But because it is such a deeply restorative, there's no contraindications, meaning there's no conditions. It's safe for pregnant women. I work on babies.
Oh,
It's
nice.
good for kids. It's good for the elderly, because it's just working within your own. I'm not pulling anything in from the outside.
Hmm.
Sometimes I'll say I'm a fluid mechanic. I'm an investigative fluid mechanic, and I'm
Yeah.
just going around the body and finding where those blocks are and helping that flow.
That's incredible. And so when people come into your office and get an in-person session, are they lying down on their back, on their front? Are they sitting?
Yes. So I have a massage table that has a pad on it and a sheet. Stay
Okay.
fully clothed. People do take their shoes off. I prefer they
Mhm.
take their watches off, just because of the electronic piece of the watch.
Yeah.
But basically just come in comfortable, and they lie on their backs. Sometimes I'll have people lie on their sides. I have some people that they have to lie the only way that's comfortable for them. And I've
Mhm.
had a few people that they need to sit up. And so I do my best to work around that. But yeah, they lie on their backs. I used to move people around more during treatments, but now I'm trying to get so much done in every session that a lot of times I don't even want to take the time to have them
Yeah.
lay on the side, because I can work anything from all the areas. So
Oh,
a lot of
nice.
times I just leave them on their back unless there's a reason to have them shift.
That's great. And then like you said, you start from their feet and then move your hands up their body. Is that correct?
Yes, I do start at the head, because there's a core current that
Okay.
is like the foundation for everybody. So I do start there, because that current is often completely blocked in people. So if the energy is not even going through to the feet, I won't get as much out of working the feet until I've put that main current in.
Okay.
And this current will actually usually correlate with people's blocks. Like sometimes it's not even going past their brain, and it's because I work with a lot of high performers, right? They're in
Yeah.
high performing jobs, and so it's like their brains are just always going, and so the energy can't, their brain is so out of balance, the energy can't even, the current can't even get through. So I start there, and that can take a long time, the first session, to really establish that foundational piece. But it's like the body just blossoms when it does. And then once I get that in, then I may move to the feet. There are times, again, because I can work the whole body from the head, that I may stay at the head the whole time. I kind of
Okay.
check as I'm going. Should I go to their feet now? Do I need to go to their abdomen? I'll give you an example. One time I was working on a woman, this is years ago, back when I was working out of my house in my early
Yeah.
days. And she came in for hip pain, and I was synchronizing her brain. And all of a sudden the thought came into my head, like, she came in for hip pain, I should probably go work on her hip. And then I got, no, like, you need to be working at her head right now. And
Yeah.
as soon as I finished that thought, she says to me, oh, it's so interesting how my hip is adjusting while you're working on my head.
Awesome.
So, it's taken me years to trust the
Yeah.
information that comes through. Really weird things would come in, and I'd be like, oh, I'm not going to tell them that. I'm not going to share that. And then over the years, I've just learned, I just give them the information, and they can do with it. Yeah, they can dismiss it, or they can really sit with it. And yeah.
Yeah. Oh, that's great. So a session is about 50 minutes. Is that correct?
About 50 minutes. Yeah. I like
Okay.
to have a little longer the first time if possible.
Yeah.
But the whole appointment is longer, because most people, if I haven't seen them before, they want to check in, or if we've done
Yeah.
a previous session, they want to check in on for maybe 10 or 15 minutes about the work we've already done. And then I get them on the table, and the session's probably 45 minutes to an hour.
Okay.
I try to always check in, even if we've been allotted a certain amount of time and I'm working as quickly as I can. I always check in, like, are we complete? And
Mhm.
so I'm not trying to push an agenda on someone's body. And I've seen
Yeah.
people come in who've had that happen. Someone's, holding this still point and like digging their fingers into the back of somebody's neck or something. And it's like, I'm just open to what the body, I do have certain things I want to try to address, but I also want to make sure I'm really listening and progressing in the level that the patient is ready for.
Yeah. And I definitely understand that, because there are sometimes people's body is not ready for step 5. And if you push them to that point, they are just going to have this resistance and nothing will work. So
Exactly.
completely aware of that. It's good to
People are,
hear.
yeah, and they're like, oh, did you, the ones that are in
Yeah.
tune with the deeper, oh, can you go as deep as you could today? And
Yeah.
it's like, well, I got through and then I got to your mental body, and your mental body was like, no, back off
Yeah.
today. Like, don't address me. And so, okay,
Yeah.
time.
That's great. And then how long do some of these effects last? And I imagine it's different from every person. So what are some of the ranges like after a session?
So I always tell people at the end of the session, it will continue, things will continue to adjust. This session will work on you meaning continue to shift anywhere from 24 to 72 hours. So I like people to drink a lot of water, flush things through, allow those changes to happen. Many people feel the effects immediately. I have a few what I call slow responders. My dad is one, for example, where like he'll come in for back pain and it takes 2 to 3 days and then suddenly it shifts. But if he doesn't come in, he just stays in back pain. Like we know it's the treatment, but he's just a little bit delayed. Most people feel better by the end of the treatment, if not by then, by the next day. And then the effects, gosh, it depends honestly, how stressful the person's life is and how much impact keeps coming in on them.
Yeah.
I had a patient years ago who used to have his back go out every 6 months or so, but he was actually someone who was in my spin class. He wasn't a patient of mine. And he wasn't coming to spin or hadn't been to spin in a while because of his back pain. And then it was starting to go again. And I don't like to sort of encroach upon people. He had his team, he had his chiropractor and his PT and this and that. But this kept going on and on and on. And his normal team approach wasn't working. So I said, if you want to try something different, because what you usually do isn't working, here's my number. So he came in and he'd been about 6 months out, one treatment, and he was back. And it stayed that way. But other people, maybe a week, and they're needing to come back. So it definitely varies. But what I have found is the more treatments people receive, the more quickly their body responds, meaning the more deeply we can go, and the longer the sessions will last for people, because the body remembers, and then it can kind of, even if it goes out, it can realign itself.
Yeah, and I imagine part of what's happening too is their nervous system is adjusting to hold them in a new way, which is part of what we want. Is we want them to change and shift and stay in their new state, whether, neutral position. And I can see how that could be helpful. So that's extremely powerful.
And a lot of us are just functioning in our sympathetic nervous system, in our stress response system. And so getting into the parasympathetic is not a place that we get to very often, where we, the body is like, hey, you're not in a life-threatening situation, you can relax now. And so if people, the more that their body remembers that, the more easily they can re-access it.
Absolutely. I completely agree. And part of my desire is to give people so many different options out there for ways they can relax and calm down. And yours is definitely one, because one of the things you mentioned at the beginning was how relaxed you feel. So those who are suffering from stress and anxiety, I imagine this is very beneficial for them as well, right?
Yes, absolutely. And we're adjusting the brain. So like, for example, I'm tuning into the amygdala, which is where anxiety comes from, and getting that in sync with the whole rest of the brain. So, really head to toe, it's good for pain. It's good for anxiety. It's good for stuck. Like I can tell when people are stuck by the pattern in their energy currents. It's like a broken record, unless some of your viewers are too young to remember records, but although Lady Gaga, they're redoing records these days, I see. So it's like a broken record where we're stuck in a groove, so we can break up those patterns. And then also, there are some people who will just come in regularly, like getting a massage to just help their stress response, whereas others have active pain. Now, look, if someone comes in and they're constipated, if this is a chronic issue, I'm getting to a really deep level, but I still want to make sure that there's not something deeper going on. Hormone imbalance, for example, I do a whole endocrine chain balance. So I'm syncing the ovaries and the adrenals and doing the thyroid and all of the endocrine organs. But also, maybe we need to do something more naturopathically, where we're actually making sure that they're not staying in a pattern that needs to be addressed in other ways as well.
Yeah, and that makes sense. And that's a great benefit, is you can address all of those things and check them out, make sure there's nothing organically going on. So very, very beneficial. So I have a question. You mentioned earlier you could do this on babies. So what kind of conditions are you able to address in a baby? I'm sure there's some parents that are really interested in hearing that.
The baby piece is tricky. Somebody asked my teacher years ago, they said, what do you do differently when you work on kids? And he said, I work fast, because, a lot of them, they're not going to sit still for too long. So babies, maybe colic, maybe difficulty sleeping, with kids, there could be anxiety, right? Or emotional patterns that they're stuck in. If ever I hear like a kid's broken a bone, it's like, oh, let me help put those bones back in sync so it'll heal more quickly. I remember being at Disney World once and seeing this little kid like bang his head on the thing, and I just wanted to go and like put all it'll make the pain go away, so much more quickly. my son said to me once, we were at the pool with one of his little friends when he was about 5 or 6, and she hurt herself. And usually I carry a little homeopathic remedy kit with me everywhere, but I didn't have it. And he said, Mama, do you have medicine on you? And I said, or can you give her medicine? I said, I don't have any medicine with me. He said, but you have your hands, Mom.
Oh,
It was really sweet. So, babies, I would say sleep issues, colic issues. My mentor actually went into the hospital once to work on somebody's baby who wasn't breathing. Their oxygen stats were really low and their diaphragm was out of sync. And he sat there and put the diaphragm in sync, watch the oxygen saturation go back up to normal and stay there. So that was really cool to get that actual measurement confirmation.
yeah.
And he also got called into the hospital. So I haven't been called into a hospital, I don't think that I can recall, but for a child who they were going to do brain surgery on because the pressure in the child's brain had built up and they wanted to put in a stent. And again, he was working on their brain and he watched the pressure come down on the machines while he was working on them. And then miraculously, they were like, oh, I guess we won't remove your, part of your child's,
skull.
Squished. Yeah. So.
Yeah. That's incredible. And it's neat when I hear some of these more alternative therapies and modalities go into hospitals to help eliminate surgeries or different medications. That's incredible. Love those stories.
It was only because the parents knew about Core Synchronism most of the time, although he has worked on some doctors who are starting to incorporate it, like one for oncology patients. But that's one of the things that's great too about the distance session. So now I can say, okay, if you have a baby, when's their nap time? Why don't we schedule in that I will work on your child? They're napping, from a distance.
That's neat.
I know for myself with my daughter, had a really hard time sleeping when she was a baby. And so every night, well, even now sometimes, because she's so high energy, I lay down with her and I do core, and just kind of put her in to get her to go to sleep.
Oh, that's wonderful. That's great. I probably have some parents that may be reaching out to you. So if someone lives far away and they want to do this virtually or distance oriented, do they have to see you in person for that first visit, or can they do a Zoom session with you so you get to know them and then do it?
Yeah, that's a tricky one that honestly I'm still trying to figure out because ideally people are supposed to see me in person. Now because of COVID, I can do Zoom visits for an initial visit if they're within the state. But if they're in a state where I'm not licensed, it's tricky because as a body worker, I could theoretically see people, but as a doctor, I'm not really supposed to see people in other states. So that one, is a little bit tricky. So sometimes people will come to see me when they're traveling through Sedona. So we establish, that relationship. One of the other things I want to say is it's also very health focused. So there's a lot of conditions, just like meditation, we could all benefit from, but also it's reaching those new levels of health. I remember one time in one of my trainings, I'm pretty healthy, eat healthy. And I love the trainings because I get work done. And my sacrum and occiput, so the tailbone and just, this bone at the base of the skull were out of sync, which is a big piece for feeling energetic. And then that got put in and I left that day and I rode my bike back to the hotel and I felt like Superwoman. And I felt pretty good when I started. And I was like a whole new level of just feeling amazing and light and energized.
Yeah, it's amazing. As a practitioner, we often don't get worked on. So when we do and get put back together, it feels incredible. So nice. That's wonderful. Is there anything else about this core synchronism that we haven't touched on that people would benefit from knowing?
Let's see. So we talked about how long it might last and what to look for.
Is there any conditions where you can't use it that you've come across?
No. I mean, even in, I've worked on people with seizures to try to calm the nervous system. Worked on people with MS.
How about dementia?
Restriction is if someone can't sit in a way that's comfortable, but again, it's a little more challenging, but I can work on them in any position. Just access those areas in a different way.
And even dementia, you could work on them as well, right?
Yeah.
As long as there's some kind of communication of permission, but if there's some memory loss, you could still do it.
For sure. Yeah. And I don't know that I have done that. I mean, certainly I've worked on people who are not suffering from dementia, but synchronizing their brains is helping their thoughts and helping their mood. And I don't know what the results would be for that, but I think that getting everything in sync is certainly going to give us our best option, our best chance at
Yeah.
having decreased progression of brain conditions. And
Awesome. That's amazing. So I know this is such an amazing tool that one, you can help people in person and as well distance wise, depending on the state and all that. But you also have started something else to broaden your reach recently, your program. Why don't you share with us a little bit about the program you're launching just in a couple weeks?
Sure. So I'm launching an online women's health initiative called the Wild Collective. And I'm super excited about it because one-on-one care is not accessible to everybody, both, just in terms of location, right? We talked about if I'm not licensed in another state. Well, this is thanks in many ways to COVID. We've taken this program online. This is an international program that now has sort of pivoted more quickly and become something that we're offering online. And so I am launching in a couple of weeks. It's called the Wild Collective, and it's a health empowerment program for women. So it's learning about all of the systems of the body. How do we become more disease resistant? What are the natural interventions? How do we understand our hormones, our thyroid? How do we detoxify properly? We'll look at all the trendy diets and digestion. And so we go through all of the body systems, mind, sleep, stress, etc. And it's, 50% education and empowerment around those areas, and then 50% connection and sharing. There's the research on connecting and the benefit of having a support group. And even in traditional medicine, when people have to they get their prescription, natural or otherwise, and then they go off on their own and they're like, I have questions, or, is anybody else going through what I'm going through? And so this is an opportunity for women to come together and hold each other up and share their stories. And I think you and Amy, you and I were talking the other day, I have women come in and they feel alone in what they're experiencing. And they'll say to me, like, am I crazy? Or do you ever hear this? And I want to say, yes, the woman that you just passed in the waiting room is going through what you're going through. I can't for privacy reasons.
Yeah.
So this is an opportunity for everybody to come together. And I'm on this journey, with them and as a guide for health empowerment and connection. So I have one more, I've done some information sessions for people to learn about it. I have one more coming up next Tuesday, and then we launch the program in a week or two.
That's great. And so this will take them on a journey for several months where each month they're learning new information, correct? A little bit of information.
Yes, it's 10 modules. And traditionally it's been done in person over 10 months, once a month. Virtually, it seemed like a month apart was maybe not quite enough to stay connected. So I chose to do it over 5 months. So we'll do 2 modules a month. So every other week for 2 hours. We meet online. There's only 20 spots available. Well, now there's only 8 left, but so that everybody's on the screen, so we can make eye contact, we can be connected, everybody can see each other at the same time. And then over 5 months, I think we start off with hormones. So whether it's PMS, perimenopause, or menopause, it's PMS and beyond. And then we do digestion and detox and thyroid and stress and my brain and
That's awesome. That's awesome. It sounds very comprehensive too. So they're going to learn a lot.
Yeah. In fact, one person just asked me this morning on my Facebook group, she said, I don't know, it feels like it might be a little overwhelming and I don't know if I'll be able to take it all in. And I said, well, that's one of the reasons, you have 2 weeks in between to kind of absorb the material, but you can go at your own pace for how much you want to integrate. And the actual sessions, which are 2 hours long, are 50% curriculum and 50% just sharing. So that it's not just, me talking at people, but it's sharing information. They have lifetime access to the information and sharing our stories and really bonding and sharing. If I tell someone, oh, take a tablespoon of flax a day because it will help with XYZ. But if 4 other women are like, oh, I've done this and this is how I feel, it's a little more actually inspirational than just hearing it from me. So it's that group collective. And from the other facilitators that I've heard from, the women just really form a really beautiful bond. And yet it's designed for extroverts and introverts. So some people go in thinking, I'm not going to share anything, and that's okay. Most end up sharing, but you don't have to.
Yeah. And I can imagine after several sessions, you get to know people, you get to know their personalities. It gets a little bit easier to share. And when you hear other people pour their heart out, it gets easier because you start to offer advice based on your experiences, and then allows you to open up to be vulnerable to other people. So
absolutely. And then I share, in fact, every session I will start off with my vulnerable story so that it's giving people permission to then share theirs if they feel inclined, as opposed to I'm going to keep everything private and ask other people open up.
That's amazing. And so how can people reach you the best? What's the best way to get in hold of you?
So you can go to my website,
Mm-hmm.
sedonanaturopathic.com, and you can book a discovery call with me. So if someone's interested in a one-on-one, they could book a discovery call. I do a free 15-minute discovery call for anyone that's interested, because as much as you want to make sure that I'm the right fit. And if I don't feel like I'm the best fit for someone, I will refer them to somebody else. And then if somebody's interested in joining the Wild Collective, like I said, the spaces are getting limited, I would reach out to me through email or through calling me. And then I think you were going to give people my email.
I can. Why don't you just let us know what it is, and I'll put it in the comments as well.
So it's drblasi@sedonanaturopathic.net. The DR is in doctor, and then my last name Blasi @sedonanaturopathic.net. And if you want to get on the list for the Wild Collective or want to book a discovery call, that's really a great way to do that. And then I can send you the information or book that call.
Yeah, that's great. And I hope people reach out to you, because even that discovery call, you can send them different directions. There's so many resources that you can provide to people on how to best fit, meet their needs and what they need for their health. So really appreciate that.
Yeah. And I try to give people the questions that will resonate for them, that will help them figure out. And I'm also pretty intuitive. I can sometimes get a sense like, I don't think I'm the right person for you, or, oh, you know what? I think I can really help you and we would be a good match.
Yeah, that's wonderful. So I'm really glad. Is there any last little bit of advice you would give to anyone? Any other information you want to share?
I would just say to really look at your health, and if you feel great, awesome, and realize there's probably another level. I've worked at up leveling my health, my mindset, all of it. That's another piece of the Wild Collective. We do mindset, which is just so important. But if you have a health condition, realize that it doesn't have to be that way. Like with hormones for women, like I said, I treat a lot of high performing women and help them find hormone balance. It's not normal to feel out of control with our hormones. It's common. And so a lot of these things, headaches regularly, feeling certain low energy, hormone imbalance, is common, but it's not normal. We don't have to suffer. And I think it's just really important for people to realize that where certain systems of medicine have maybe not offered them solutions, there are other ways out there, and we can feel really, really good.
Yeah. Oh, I appreciate that, because a lot of times we just think, okay, it's a normal part of aging, normal part of being female or male, whatever it is. And I say nothing's normal.
And particularly women, there's this idea like you just have to suffer. Like you're a woman, you have periods, you have menopause, like you have to suffer. Those don't not monthly, not when we're losing our cycles. We don't have to suffer. Men, you too don't have to suffer, but it's not as expected. If a man went in with some of the problems that women went in, they would be given a medication, they wouldn't just say, oh, you're all saggy and dry. Okay, well, that's just part of aging. No.
I totally agree. I tell people all the time, pain does not equate age. Just because you are in your 60s, 70s, 80s, that does not mean you have to have pain. Exactly. Arthritis does not mean pain. I've said that so many times over and over again. And, sometimes you just need to meet the right person to guide you on that track so you can change your mindset and realize those beliefs that you had about your body state doesn't have to stay that way.
Right. So, exactly. Brain fog should not be a part of getting older. There's ways to address that.
Yeah. Good one. Yep. Well, I really appreciate your time tonight on a Sunday evening. Thank you so much. I know this is your weekend and, rest time. So I appreciate your time, and thank you so much from the bottom of my heart for joining us tonight.
Likewise. Thank you so much for having me. I'm so glad my daughter didn't come banging on the door while I was in here. And it's been fun. Thanks a lot for calling me onto your show. And if anybody has any questions about whether any of this is right for them, just reach out to me at that email. And I answer it personally. I don't have an assistant, so it'll be me responding, and then we can.
That's wonderful. And thank you all for joining us tonight and tuning in. Really appreciate your time, and I hope you learned a lot. I know I did from Dr. Blasi, and she's a great person to reach out to. So please take advantage of her in a good way to help your health and improve your life. So see you again next weekend. Have a great evening.
Let me ask you one question. Is it too much information to tell them about the Facebook page?
You can, go for it.
So I have a Facebook page. It is just for women, but it's called Optimize You. And if you request to join, just say that you heard about it from this show. And it's a group for women to help really, again, I get on there and I do free Facebook Lives on thyroid, on sleep, on hormones. And I just ran a 5-day challenge, and it's just a lot of fun. And it's about having a supportive place to go for women to get good health information and share. So that's called Optimize You. So you can find me there as well.
Awesome. Well, thank you guys all. Take advantage of that. Jump onto our Optimize You page. I am actually a member, so you might see me there as well. So have a great weekend. We'll see you again next weekend. Take care.